Alaikum now. Hello, it's OFP, likely to discuss about cervical radiculopathy. Starts with the nerve root. The nerve root C5, the reflex affected is biceps jerk or biceps jerk is lost. Now dermatum and myotum, that means the sensory loss and the weakness. In C5, the sensory loss would be lateral upper arm, and the weakness would be shoulder abduction and elbow flexion. This is all about C5. Again, try to remember in a simplest way. C5 nerve root, then reflex effect is biceps jerk, biceps, then the dermatom and myotom. That means the sensory loss. The sensory loss would be lateral upper arm, and the weakness, that means myotom, would be shoulder abduction and elbow flexion. Shoulder abduction by the deltoid and elbow flexion by the biceps. And C6. In C6, reflex is biceps and brachioradialis. The sensory loss would be thumb and index finger, and the weakness would be again elbow flexion, which is done by the biceps, forearm pronation supination, and wrist extension. Elbow flexion, forearm pronation supination, and wrist extension. These three is done by the C6 and the C7. C7 has triceps, reflex affected is triceps, and the dermatom, that means the sensory loss would be middle dorsal forearm and middle finger, dorsal forearm and middle finger. And in here, as it is all in here, there is the opposite of C6, that means elbow extension, finger elbow extension, wrist flexion, and finger extension. Wrist flexion and finger extension. In C8, there is finger flexors. In T1, also finger flexors. These two usually not typically evaluated clinically, and in C8, the reflex is ring and index finger, and in T1, the medial forearm. The weakness is, in case of C8, the weakness is finger flexion and extension, and thumb flexion and abduction. And in T1, there is thumb abduction and adduction. And the sensory loss is medial forearm. Hope we enjoyed.